To find out cervical capability, that is cervical competence, with normal cervical length, cervical elastography plays an important role where we can have a soft cervix with normal appearing cervical length, including internal os as closed. So what a normal cervix in elastography will have is the hard part. This is the bluish discoloration part with graded compression to the anterior cervical lip and evaluating in different segments and multiple times. A consistent bluish portion starting from the internal os to the external os is indicative of a normal cervical competence by elastography. Now let's come to a case where like a prior history of unexplained 5th or 6th month pregnancy loss, and she is having a precious pregnancy, and there is a apparent this is the case. The cervix is from this end. This is the anterior cervical lip. This lady with IVF and a precious pregnancy, very good couple. They come for this cervical length evaluation. Transabdominal study was normal and falsely normal because there were abnormal vessels which were adding up into the cervical length. So coming to the elastography part, so this cervix in most of the part is red or range of yellow, and this is the internal cervix, cervical canal. So this persisted for multiple attempts, and it was soft cervix. There was no internal os opening, nor the cervical length was not abnormal. It was around 3 centimeter. Yeah, it's like up to here. This is the cervix. Don't go by this. This is some tissue, but this is the cervix. Yeah. So it happened like it persisted. I've done multiple times. You can see this portion. I'll come again. I'll come to the normal part, normal cervix. This is the bluish portion. This is the hard part. This is the soft part. Now a soft cervix on elastography will have reddish portions and range of yellowishness. So we should be cautious, have a clinical examination. Then this is the cervix. You can see this is the normal cervix, and this is the bluish part. The bluish part is the hard part, which like is firm. It is firm cervix, and we have to make sure that this we have to take it to the green part multiple times and evaluate at multiple times. This is not quantification, but by visual assessment of stress elastography, which is available, and um, and still it is in somewhat like a cutting edge or mm, uh, technology. So we should be cautious on this case, but they had clearly certified it as cervical incompetence, and the lady had the precious pregnancy, and this was her cervix, soft cervix. So they went in for cervical encirclage. This case is of a normal cervix which came for other reasons, and I've been doing this study right now. If any cases pertaining to suspected or there is a need to evaluate the cervix and there is a precious pregnancies, I'm always there, and if possible I'll reduce the charges or not take extra for elastography on purely science basis. Thank you.